her fuzz.
Her duck fuzz.
We've heard, my 2-year-old called it her grass the other day. Oh. And we've also heard dandelion or a chia pet.
Brylie came to Nebraska Medicine after 3.5 months in a NICU down in Kansas City. We were there and she had had 3 surgeries and things just weren't going so well for her. She still wasn't able to eat, and so through a network of moms, I was able to get in contact with Dr. Mercer, and I called him on his cell phone, and he started the process of getting Brylie up here.
And I realized, this is perfect. This is exactly who we need, the kind of patient who will thrive here. It became fairly obvious to us within a short period of time that we were going to have to do a little surgical intervention on Brylie, just to change some things with her intestine. A step procedure is an operation whereby we take that big, stretched out, dilated intestine and we narrow it into a much smaller tube. It looks like kind of like a coil or a zigzag, and it allows us to take the big dilated piece of intestine and make it into a more narrow one that ends up being longer. And that really changes the way the intestines can squeeze and how the body's able to absorb nutrition. And so when children are struggling, like Brylie was, with vomiting and not being able to handle any feeds, you make this profound change to the intestine, and it's like a light switch is thrown. And within a week after surgery, the vomiting was all gone away, everything was turning around, and then it was just a matter of slowly and steadily advancing up on her calories and working on things by mouth.
By then, she'll be eating so much more food.
Brylie loves to eat anything we put in front of her. She loves cereals, she loves eggs and sausage, anything with spice. Had we waited longer to get her here, things could be very, very different for her. She would not be where she is. She would not be off of TPN and off of her tube feeds, and she will be off of all medications, off of all equipment, and just be the typical baby that she looks like.
All right, how's Tony? What we did with Brylie and what we do with children like Brylie, this is what we're best at. It's what we eat, sleep, and breathe 24 hours a day, 7 days a week. And we have children who come from all over the country. When you have that many children that you're managing, you get very good at it. You start to learn how to move things along, when there's problems and when there isn't problems. And I think that we have amassed a team of various experts from, surgery and medicine and nursing and nutrition, all these different areas. And when someone comes here, we can band together along with the family and with the patient. And I think we can create a plan like nobody else. And when you look at our results and our outcomes, our results are better. We do take on the most challenging children, and we are pretty successful.
Every time I come to a clinic appointment, I'm just able to relax and to be a mom and to leave the medical care to the doctors and the nurses. I trust their opinion and that they will know what's best for Brylie.
Brylie, can you say hi? Hi.
I never thought that at a year old she would be that 100% healthy little baby that's thriving on her own.
She'll have some scars on her tummy, but she won't really remember any of this. But her mom will never forget, or her family won't forget everything that they've gone through.
It's hard. It's hard. There's been many tears shed, but day by day you get stronger. Moms are strong, but these little babies are stronger.
I'm sure somebody will ask her someday and she'll say, oh, that's something that happened when I was a baby. And, we went to Nebraska, but I'm all better now. I can't think of a better place to be if you had a child with short bowel syndrome. This is where I would want to go.